Researchers have developed a new blood analysis method that can detect early-stage ovarian cancer. High-grade serous ovarian carcinoma, HGSOC, is the most common and deadly type of ovarian cancer. One of the reasons for such high mortality is the lack of effective methods for early diagnosis of ovarian cancer. In patients with pelvic masses, it is difficult to determine before surgery whether the mass is benign or malignant. Traditional biopsy methods are often not feasible. This creates challenges for doctors in selecting the best course of treatment. However, a new blood test based on the detection of specific nucleic acids circulating in the blood may change this situation. Preclinical studies have shown that the new blood test can more quickly determine whether a pelvic mass is benign or malignant compared to existing tests. This allows for a more appropriate surgical approach to remove the mass and improve patient treatment. Additionally, researchers are also exploring the possibility of using the new test as a screening tool to detect early stages of ovarian cancer in asymptomatic women. Early detection of ovarian cancer significantly increases patients' chances of survival. This new blood analysis represents a significant breakthrough in the diagnosis and treatment of ovarian cancer. If there is an opportunity to accurately identify cancer at an early stage, it could change the course of the disease and increase patient survival rates. The overprint test utilizes a method of cell-free DNA methylation, which is a new and promising way to detect various types of cancer at early stages. This test looks for methylated DNA fragments that circulate in the blood. Methylation is a complex process of DNA modification that can alter gene expression in the body and be used as a biological marker for diseases. The primary goal of the overprint test is to identify aggressive serous ovarian cancer, HGSOC, at early stages when it is still easily treatable. This sets it apart from most existing ovarian cancer tests. In the study, over 370 tissue and blood samples were collected from patients with HGSOC, as well as from patients with normal ovaries and benign tumors. Using next-generation sequencing methods, genomic regions with different DNA methylation patterns in normal tissue and HGSOC tissue were identified. Researchers were able to determine DNA methylation patterns associated with HGSOC and develop a blood test that can detect methylated DNA fragments. This unique blood biopsy was tested on plasma samples from patients with HGSOC and patients with benign ovarian tumors. The accuracy of the test is determined by its sensitivity, the ability to detect patients, and specificity, the ability to exclude healthy individuals. Overprint has an accuracy of 91%, indicating high sensitivity and specificity, while other tests on the market have either high sensitivity or specificity but not both simultaneously. Robia Salia, founder of the biotechnology company CPG Diagnostics Inc., plans to promote Overprint as a new tool for diagnosing ovarian cancer. She and her colleagues plan to conduct follow-up research on hundreds of patients to confirm the test's effectiveness. If the results are positive, they hope to release a commercial version of the test for clinical use within 2 years. They are also considering modifying Overprint to detect other subtypes of ovarian cancer. Ultimately, researchers aim to optimize the test so that it can be used for widespread population screening.